My name is Dr. Tina Tanner. I'm the Vice President of the Michigan Academy of Family Physicians and a small-town physician in Hesperia, Michigan. Family medicine has always been my passion. Part of the reason that I'm involved with the Michigan Academy of Family Physicians was simply because I found in my first few years of practice that I could not access the services that I needed for my patients without being politically active. Medicaid expansion is an example of that. The Medicaid expansion is part of the Affordable Care Act. The goal is to expand insurance coverage to individuals who do not qualify for Medicaid currently, but do not have access to insurance through other means. An example of how the Medicaid expansion will help families in my practice is that I have a family of 4 that previously qualified for Medicaid when he was unemployed. He found a job, and at that point in time, both he and his wife lost their insurance coverage through Medicaid, and the children as well. They did qualify for my child for the first year. The next year in the same job, he made $44 more, and his children no longer qualified for Medicaid. We're talking about a family that makes $32,000 to $35,000 a year of 4. Medicaid expansion would allow them to have health insurance coverage. They'll have insurance coverage so that they can come in to see me regularly, other than when they're severely sick, severely ill, or have no other recourse. It can, in some cases, bankrupt some of my patients when they finally come in to see me. They're so ill, things that could have been prevented, and instead I have to hospitalize them. Most of the time, my family didn't have insurance. I understand what it's like not to have health insurance. I also understand what it's like to be very poor. I saw a lot of my relatives very ill, not able to get health care, and ultimately died because they didn't receive health care early on from diseases that were preventable. The Medicaid expansion will allow nearly 500,000 uninsured adults access to health care. We know that when people have regular access to primary care, they are healthier. When they are healthier, they utilize the healthcare system less at the higher levels, therefore we save money. As a family physician and the Vice President of the Michigan Academy of Family Physicians, the Medicaid expansion is not a political issue. It is a patient care issue. It is about compassion, caring, and equity. By expanding Medicaid, we will offer access to a family physician to more families in Michigan. This will improve their health while decreasing the health care costs of Michigan. Please support the Medicaid expansion.